much, Nathan. Okay, and as we begin to wrap up and open for questions, I just want us all to reflect a little bit about what we've heard and really, let's do this. I got it. Okay. And really contemplate the opportunities for Capta and how Capta could increase capacity for the kinds of programs you heard about in North Carolina and Colorado that are effective at both primary universal prevention and also at targeted prevention, at intervening in families like Nathan's and intervening to stop abuse from happening again and helping survivors live healthy, productive lives. There is opportunity in Capta for innovation. What we need is innovation. We know that there are evidence-based programs out there, but the full implementation and scope of these programs has yet to be realized in a wide spread nature across our country. So scale up is vital. Demonstration projects in the form of block grants that go to states for innovation would go a long way to move the needle in terms of rates of maltreatment. And just bolstering our evidence base in ways that we haven't seen realized before. So our takeaways, if you take nothing away, take away that child maltreatment affects a significant portion of our population. 12.5% of kids in this country will be victims of maltreatment by the time they turn 18. The consequences are dire and the costs are substantial. 1% of the GDP is spent every year on the public health problem of child maltreatment. And current prevention efforts are not impacting rates. Rates have been stagnant for over a decade. We are back in the 90s, the last century in terms of prevention. And the way that Capta could be leveraged to change things. So I'm going to stop talking and open it up for questions. If you have a question for anyone on the panel, please ask it and engage as much as you want to, because we have the room until after 3:30, so no one's going to keep us. Oh, and don't forget to fill out your evaluation. Please, please, please. That'll be very helpful to us as we move forward. So I'll open it up to questions now. Or comments. Yes?
Nathan, not to, I guess, too personal, but do you think your mother could have been helped at some point, or is it you just need to have that alternative of foster care and adoption?
So the question was, do you want me to come up there?
There's Facebook Live going on
We're
now.
live streaming, so if you could come up, it'd be great.
Yeah,
Because there's lots of people who are attending.
Yes.
Thank you, Nathan.
Yeah, of course. The question was, do I think that my birth mom could have received some help and done better with prevention? I absolutely do. And so a month after I got married, I went and actually saw her for the first time. She got 7 consecutive life sentences in prison. So our community was in such outrage and for those of you who don't know, that's an extremely high incarceration sentence for what she's done. So I went and saw her, and one of the things that she told me, which I remember from being a kid, was that there were several times that she actually took us to the court to get us to the court because she felt she couldn't take care of us and was worried that she was going to hurt us. And she was told on several occasions that she just needed a timeout, that she needed to go and send them to our grandparents, take a little vacation for herself, and then she'd be okay. So yes, absolutely. I think that if someone had listened to a person who ended up doing what she did and say, I think I might do this, we would be having a completely different conversation now.
Question generally. I understand that the Colorado program is funded by CDCAP. Can others direct us more directly? Create a tighter line to which parts of Capta fund the services or evidence-based programs that you're talking about?
Yeah, yes,
I don't have the answer to that question, but I can find it for you.
Any of you, I mean, you could come up and stand up. But I do think it's CDCAP primarily within Capta. Anything else?
Right.
So
Yeah, go ahead.
I was just going to ask another question. Sorry.
Okay.
Sorry. So specifically, you talked about effective implementation. Evidence-based practices are great. If they're not being implemented properly, it's not helpful. How, as members of Congress, would our bosses support effective implementation? Is that through more accountability? Is it just more funding? How can we do that?
And thank you for the question. So the question was, how can members of Congress support more effective implementation in the authorizations or in the legislation that's passed? And so one thing I will say that federal government has done a really good job of, in my opinion, and I would love to see continue, is that when discretionary grants are put out for child abuse and neglect services, whether they're prevention or intervention focused, we're seeing more and more a phased implementation type of plan. So we have a year that's built in to a 5-year grant, for example. And that is extremely helpful for states and jurisdictions to take the time necessary to really explore and figure out what are good fits for their community, for their state. And in fact, we know from the research around implementation that when we spend the requisite time exploring and really understanding the readiness that we need to implement something well, that we are going to see better outcomes. So we already see evidence of that happening in Congress, where we have, through certain federal funding sources like Capta, and other funding streams that are administered by the Children's Bureau, where the states have the discretionary opportunity to apply, we're seeing that year built in. I think the other thing that we can really leverage, and we can get a lot of return on investment in terms of understanding. So much happens when you understand this notion of implementation, and I think just that shift in and of itself is really an important one to make, that we, by building in the time for the readiness and the exploration of the work, but also resourcing more streams of funding like Capta that allow for capacity building to happen at a local level. We don't see that very often. We don't see that in most of our federal funding streams and most of our state funding streams. It's implement means go do, and go do quickly, and we want to see services in place very quickly. And nothing will really ruin an intervention faster than doing it too fast. And so I think that the more that we can model Capta, and with respect to that, the community-based child abuse prevention is a great example that allows states to fund both direct service delivery, but also the work that I highlighted that's happening in North Carolina around capacity building. Those would be two ideas.
I have a quick follow-up question.
Sure.
Both to yourself as well as Dan. And that is, both of you were able to evaluate your programs. Right now, there is no resources in Capta for program evaluation. It is strictly for program implementation. So how were you able to evaluate your programs, and what recommendations do you have for other states to be able to do that?
A good point. So the question was in terms of evaluation, there's very limited dollars that can be earmarked for evaluation of the interventions, but yet it's such an important part of the work, because how else will we know what we're doing is really yielding the outcomes that we want. So in North Carolina, one of the beauties of our public-private partnership is just that. So we have extraordinary relationships. I mentioned the Duke Endowment, for example. We have great university partners out of North Carolina State University and the University of North Carolina Chapel Hill, to just name a couple, that have really come into this fold with us and have been able to finance and resource the areas of the work that state funding and federal funding just don't have. So for us in North Carolina, it's that public-private partnership collaborative that we have that can help do the evaluation work, and that's what's happening with respect to PPP. We also have, I will mention that on the public health side in North Carolina, that North Carolina Division of Public Health really was and still is, like the administrative home, if you will, for PPP in North Carolina. It's a population level program. Much work was happening before the North Carolina Child Welfare System received some dollars and came into this partnership with the Division of Public Health. And so there were already some great systems of evaluation already set up through our Division of Public Health, data collection, and statewide ability to take a look at trends and other types of outputs and outcomes. Deanna?
And for Colorado, it was state funding to see if that program is
Go
going to
to
work. It's going to work as good as it can.
Do you happen to know what the line item was that was
No, but I
used?
can get that for you.
And for Colorado, you mentioned being an implementation coach. Can you talk a little bit more about what that entails and what that role is of really being able to provide that implementation coaching, making sure that programs are staying, modeling the fidelity the right way?
Right, well, it's a great question. There's a lot to it. A lot of it has to do with having communities make the decisions about what kind of programs that they want, working with their local partners to both identify that and identify providers of those services. And so it's making sure that the voice in the community is heard. That's really step number one in implementing in any community.
But is that part done through the CBCAP funding, or is that through your state funding as well, to be able to pay for those implementation coaching?
I don't have the answer to that specifically. I'm sorry to say, but I'll get it for you.
The passage of Families First last year, have any programs that resulted from that legislation already begun contributing to your work, or is that more of a separate?
So in North Carolina, we're still reviewing that Family First legislation. We're really taking a strong policy analysis to take a look at where the opportunities are for North Carolina in terms of the prevention option. There's a lot of work happening in North Carolina that I believe has allowed us to have the infrastructure and some readiness to embark upon the Family First Prevention Services Act already. There are many of the programs that we believe that we are implementing in North Carolina, we believe may make a list from the Children's Bureau in terms of viable options for states. So I think that this type of work that we're doing in North Carolina relative to Triple P, and we have other examples of that happening, not at a population scaling type of way, but we have other evidence-based programs that we're partnering with the Duke Endowment and Prevent Child Abuse North Carolina to do local implementation support to ensure fidelity to outcomes. That type of infrastructure that we're building is going to be critical for us in terms of really implementing in a family first environment, because we're going to have now in child welfare proper, where our county child welfare agencies, we're a county administered system, state supervised, are going to have the opportunity to engage in prevention services in a way that they never have done before. And we've heard from our other presenters that we have lots of challenges in child welfare, lots of competing demands and priorities. And so paying attention to the implementation of an evidence-based program, whether it's for substance use disorder, mental health, parenting skill building, really is going to take quite a lift of the other state partners in our state and in any state to make sure that those services can be implemented really, really well. So the long answer to your short question really is, I think that this is an example of what we will want to try to build in our state in the family first environment.
What does a Triple P model cost to implement?
What does Triple P cost? I do not know the answer to that question. It's a great question. I think that costs are variable. We have some cost data out of the U.S. trial, the population trial. I don't have committed to memory, but I can get that answer. But we have such variability across our 100 counties in North Carolina in terms of where individual counties are with population Triple P. We have some counties that are only implementing some levels, some that are trying to implement all 5 levels. So again, I don't have that answer. I think it's a great one. It's one of the things that we need to study as a part of our Triple P work to really understand where the cost savings are going to be relative to abuse and neglect in North Carolina.
And I don't know if this will help you, John, but Casey Family Programs just did a really wonderful evidence-based assessment. Christy, I'm sure you can talk about this. And the cost evaluation was a part of that. Triple P is on that list and there are costs. So you can look at that.
And just to follow up, if you don't know already, HHS has already put out some of their evidence-based programs with a clearinghouse, and that should be on their website soon.
Do you have a date? Soon. The answer is soon.
Soon.
Is tomorrow's briefing still on?
I'm sorry?
Is tomorrow's briefing?
Yes.
We are still on. Fingers crossed, people come.
That helps us to throw also on the WISDOT website, Washington and State Public Policy.
Yes. Yep. If no one has one, I'll ask another question, if you don't mind. Besides families that come into contact with the child welfare system, are there other ways that you target families or populations that you think are at risk?
Well, so there's been recent work that suggests about,
And if you could repeat the question for our Facebook Live folks?
yeah, so she had asked about how, other than through CPS, families might be identified. So CPS does identify most of the families. So there's a recent article that showed about a third of children in the US are investigated by CPS at some point in their life. So the odds that CPS isn't finding out are actually relatively low. It's more about whether they do something when they find out.
Yeah, and that's a really interesting point too. CPS is often the very first point of contact for most of these high-risk kids. It's because we're all watching out, right? How many of you are mandated reporters in this room? A lot of us are mandated reporters. We're referring kids to the system. If we could think about prevention in an innovative way, as once a kid is referred to the protective service system, then services are actually granted, that prevention actually starts. We could see a reduction in child maltreatment rates, but also a reduction in a lot of the other childhood conditions that we care so much about. Substance use, teen pregnancy, delinquency, and then that straight line from juvenile justice to criminal justice to, right? Those are the kinds of things that we're talking about. And speaking, I'm going to add to the Families First statement here. What's needed is innovation as well as supporting the evidence base that's already out there. The evidence-based programs that we can promoted through the Families First Act, those have to make this evidence-based clearinghouse list, as being evidence-based, and that has a definition. But what we need is even innovation within the evidence base, because the evidence-based programming is not working, right? And evidence-based needs to be implemented in a way that's innovative. We saw that today with several of our examples. So it's not just how we can benefit from the Prevention Services Act, but what innovation can be sparked by block grants from Capta. I mean, that's, I think, one of the take-home messages here.
So just to follow up on that, so when you're looking at what Congress has done in the past year and the direction they've gone with child welfare, and then you look at Capta, perhaps you're not seeing Capta in the same way because the direction has shifted. Would that be accurate? I mean, should Capta be the same Capta that is there, or should it be looked at in a different way?
Anthony, why don't you come up and talk about it? I'm going to let somebody who's not from Penn State answer.
Good afternoon, everyone. My name is Angelique Day. I'm with the University of Washington and Partners for Our Children. It's one of our sponsoring organizations today. We've been doing a lot of work at what we would love to see in terms of changes to Capta. Certainly, we've heard about 2 evidence-based models, but certainly many of the models that have reached evidentiary standard and have been applied may not apply to all of the different populations that we care about, right? The needs for young people in tribal communities may look very different than needs of children in African American communities. So there is some room to further and explore and to see if these models do work with other populations. So ideally, we would love to see some flexibility within Capta to apply these models and make necessary modifications so that they can be applicable to all the populations that we care about. I see John as a follow-up.
Yeah, just a critical point. I mean, Family First hopefully will be great. It's intervention services for the most part. What we're talking about here is primary
We are,
prevention.
absolutely.
And we can't lose sight of that fact, because what Families First is tied to an intervention and the child being a candidate for foster care. And what you're talking about is getting to the community long before that ever happens, so we can't lose sight of that.
Absolutely, absolutely. And certainly we know that compared to 4E, Capta is such a very small budget. So certainly we are asking Congress in the reauthorization process to really look at what is the funding that we need to actually do this work right. We know that prevention saves money on the back end, but we have to invest in it to see it come to fruition.
And underscoring opportunities for government university partnerships. We talked about how are these programs evaluated? How do they reach the evidence base? Well, a lot of times that means you have to partner with those who have the time and are building their careers around understanding this kind of science. So I'll give an example. In Pennsylvania, the Office of Children, Youth and Families wanted to enact a universal sexual abuse prevention program in Pennsylvania. And so they asked us at Penn State to partner with them. They did the implementation, we were doing the evaluation, and through that program, we're training 5% of the adult population, 100% of second graders, and 100% of high-risk parents within children and youth. And they're allowing us to do a controlled trial of this. So the only way that happens are these innovative partnerships that I think also Capta can promote through demonstration projects to states. And in that way, I think we grease the skids from the evidence base to practice if we can partner with researchers that way.
And I think you heard in the examples, before, is that in terms of federal money drawdown, there isn't that resource now for states to partner to do that public-private partnership without really putting the onus on the state or the university to find a grant to be able to make this happen. So what can we do in Capta reauthorization to support and incentivize these public-private partnerships to ensure that we get the robust evaluations that are necessary to meet the requirements of an evidence-based clearinghouse? That's where we need to go next.
Can you talk about any examples about primary prevention with reaching the community through hospitals, through schools, like other ways, as we were saying, of reaching these families? Any experience that you know of that states are doing?
Yes. I mean, yes, there are isolated programs here and there, some that have showed evidence-based and some that are evidence-informed or promising practices, right? But for example, and it also depends on what kind of abuse you're talking about. I mean, we have to understand that sexual abuse is a little bit different. I mean, when we're training parents to discipline their kids differently, we're thinking about physical abuse. When we're training parents on how to keep their kids safe from things around the house, or getting support for parenting and resources to stave off neglect, right? That's a different message. When you're thinking about sexual abuse, it's a completely different animal. It's a different prevention strategy. So often we see prevention programs at the universal level working for one type or another, but not all together. So one of the things that we're trying to do in Pennsylvania with the sexual abuse prevention is let's take evidence-based parenting strategies that are often used in universal prevention and tack onto that curricula that covers sexual abuse in an extra session or an extra 2 session or something that's braided in. And that is the same curriculum that's used in schools. It's the same curriculum that's used to train community members, teachers, and so forth. But the information has to be disseminated in a way that can be sustained, right, in terms of universal prevention that's used in other agencies, like the Child Welfare Agency. So there are programs for physicians. There are programs for teachers, for elementary and middle school aged children that have to be sort of innovatively implemented in ways that are sustainable, right? So that's the challenge, is taking those and making them sustainable, right? Anything anybody else wants to say? What do you want them to go home with? Okay, I gave a nice bullet that my computer's dead. Thank you all for devoting your time to
Thank you so
challenges.
much.
And let's give a hand.